radiofrequency ablation is a procedure where we use a needle, a small one, and place it under live x-ray down onto the bone in this location in the low back. It's between two structures called the transverse process and the superior articulating process. There's a nerve called the medial branch. The medial branch innervates two things. It innervates a muscle, a very small muscle called the multifidus, and the other is its sensory, or it feels sensation or pain from the facet joint. We use that small needle. Small needle is kind of special. It's insulated, and a machine we hook up to the needle speeds up radio waves, so it gets hot. So the tip of the needle heats up, and we burn that nerve, and so you no longer feel the pain in your back. First off, we got to talk to you, history, do a physical exam, and decide whether or not your history and your exam fit with the diagnosis of facet-mediated pain. If you do fit what we think is diagnosis of facet-mediated pain, we go to the procedure room and we use a small needle and we inject local anesthetic down again where that medial branch is. And we do usually at least 3 levels, sometimes 4. If your pain is reduced for a temporary amount of time, most often we do it a second time, just to make sure you're getting pain improvement. If you do, then we schedule the radiofrequency ablation procedure. We start an IV, give you a little medicine to make you sleepy, and then we place those 3 or 4 special needles in the back under live x-ray, right on the nerve, and we burn the nerve. You wake up from the anesthesia 6 to 10 minutes later. Unlike other procedures, you're still going to be sore. And imagine getting a really bad sunburn under your skin. So you're going to be sore for 2 or 3 days after the procedure, and you're not going to notice a big change in your back pain for a good 2 to 3 weeks. There's actually 3 or 4 other locations in the body we can do this on for chronic pain symptoms, specifically from a spinal origin. One is a procedure I love to do because patients do so well afterwards. It's called treatment for third occipital neuralgia, or it's basically a headache. And it's a headache caused from the upper spine that will radiate across the back of the skull, called the occiput, into the side of the head, called the temporal region, and sometimes into the eye. Procedure's the same. We do a test where we inject a little local anesthetic down on that third occipital nerve. If you get better after 2 tries, we do the radiofrequency ablation on the 3rd try. Another treatment for radiofrequency ablation, it's for knee pain. We're doing the same radiofrequency ablation procedure to 3 of the 6 nerves that innervate the knee. And I place that needle down around those 3 nerves in your knee, and we radiofrequency the lesion around the nerve. And then again, it takes a couple, 3 weeks to really see the complete improvement, but your knee pain usually goes away. And talk to your physician. Procedure itself sounds scary, but it's not. It goes much quicker than you think it will. There's really no big concerns from this procedure. It sounds like there's a lot of bad things that can happen, but in reality, the procedure we're doing is actually very, very safe.